Yes.
And I have some of your other information here, but I'm wondering if you have any questions for me right off the top.
No, I don't. Liz is, who can't be here today, that's our daughter. And
Okay.
my husband David is listening.
Hi.
She has a couple, but I'll wait till you're finished telling me what you think will be the sort of next steps.
Okay. So I understand that you had a spot on your elbow removed a few weeks ago, or about a month ago.
That's right.
And you had another area biopsied on your left cheek.
Yes.
Do you have any other spots?
That I can feel?
Yeah.
No, but Dr. Phillips told me there's another spot that is now pressing on my vocal cords. He removed, I think a year ago, he removed one of those spots that was leaning on my vocal cord. And at the time he said there's another one there, but I couldn't reach it. And he removed a gland that makes saliva under my tongue at the same time. And they were biopsied after surgery, and all it would show was inflammation, he said.
Okay. And are you having any problems with your vocal cords, like any change in your voice or difficulty swallowing?
I have no difficulty swallowing. About a month ago, I would say I became a little hoarse. And that was certainly a symptom of the previous one that Dr. Phillips removed. I was quite hoarse.
And are you having any fevers or sweats?
No.
Weight loss, anything like that?
No.
You're otherwise feeling pretty well?
I am.
Excellent. And the spot on your elbow, had that been there a long time, or was that there just came about?
I didn't notice it until maybe it was 6 weeks or 8 before I saw Dr. Henry. I don't think it was there for a long time, but I don't know.
Okay. Was it bleeding or painful or growing?
No.
Okay. Was it a skin colored or a different color? Was it red or purple?
The outside?
Yeah.
No.
Okay. And you've never had any enlarged lymph nodes or been told that you have cancer at all in the past?
No, and I have Sjogren's, and I see Dr. Clements Baker yearly, but because of COVID, I haven't seen her within my year time.
Okay.
And she always checks my neck.
Okay. And how long have you been on the treatment for your Sjogren's?
01.
So you've been on almost 20 years?
Yes.
Okay. And how is the Sjogren's affecting you?
Well, from its start, it had a swelling around my left jaw that was quite swollen. And that's the blood work that the family doc at the time looked at made the diagnosis of Sjogren's. Then there was no medication prescribed, and it settled down, and it became a non-issue. My mouth has been slightly dry over these years, and sometimes my eyes are dry, but that often depends on the humidity in the air. So you know, at one point a few years ago, Dr. Clements remarked to me that sometimes these things just simmer out. And
Okay, and your eyes have never been a big issue, or?
no, sometimes I use over-the-counter drops if it's, you know, I've been reading a lot or it's super dry or, you know, like in the winter when the heat's on in the car.
Okay, okay. And you just had a CAT scan, I understand.
Yes.
Okay. Okay. So what we typically, and have you been told what the biopsy showed from your elbow?
Yes, Dr. Phillips told me that it was a low-grade, what word did he use? Indolent or indolent lymphoma.
Okay.
And
So,
yeah,
yeah.
and that he didn't want to, he said, it's not my area. I don't want to sort of try and guess what your treatment might be.
Okay. So this type of cancer, like lymphoma, is a cancer of the immune system. And people who have immune system problems already, like Sjogren's, have an increased risk of getting cancers like lymphoma.
Yes, I've been told that all along.
Mm-hmm. And this is a cancer you've probably had for many years. And because indolent means really slow, so it's one of these things that kind of grows. And if it's not bothering you, we leave well enough alone. But if it's starting to bother you, and like for the instance, the hoarseness and other issues, we would then want to treat it. So the CAT scan that you had is helpful to, you know, it's showing the mass near your larynx and near your vocal cords.
Yes.
It shows that otherwise you don't have a lot of enlarged lymph nodes. There's just one lymph node that's a little smidge bigger than normal in your right groin.
Right.
And there's a few other little things, like little tiny nodules in your lung and a lesion in your liver, but we don't know if these are cancer or if they're just benign. So we do have to do another scan.
Okay.
So people with lymphoma, we usually send them for a PET scan. And a PET scan is a specialized test. You have to go to Ottawa for it, at the Ottawa General.
Okay.
Because we don't have a scanner yet in Kingston. And it's like a CAT scan, but they also inject you with a sugar-like solution, and that will tell me exactly where your cancer is and whether any of these spots in the liver or the lung are worrisome as well.
Okay.
The scan is also showing that your right collarbone is broken. Is that new, or has that been going on for a while?
No, that was September 3rd when I fell off my bike.
Oh, no.
But it's
Okay.
healing really nicely.
Okay. And what we typically do with this sort of cancer as well is do a whole panel of blood work.
Okay.
So what I would suggest we do is send you for a PET scan so we can have a better idea of exactly what stage you are, like where the cancer is and how advanced it is.
Okay.
And have you come to see me, and we can do your expanded blood work at that time.
Okay.
Okay, with this sort of cancer, because if it wasn't bothering you at all, I'd say let's leave well enough alone. But because of the hoarseness, I think we're going to have to think about treatment.
Okay.
So the treatment we usually use is chemotherapy. And the chemotherapy that we typically use for this is a combination of two drugs. One is called rituximab, and the other is called bendamustine. Now, we can send you in the mail some information sheets just to read about this, just so that you can become familiar with it.
Okay.
This is given as an intravenous treatment for 2 days in a row every 4 weeks. So you get it like 2 days, and then 3.5 weeks off, and then 2 days, and then 3.5 weeks off, and we do that 6 times.
Okay.
Okay? And we would do scans in between the treatments, like after the third treatment, like halfway through, and at the end of treatment, we would do another PET scan just to make sure that everything is resolved.
Okay.
If there's anything on the scans that are worrisome for another problem that's not related to the lymphoma, then you might need further biopsies. But typically, we would try the chemotherapy and then see what happens.
Okay.
Chemotherapy, especially the rituximab, will treat your Sjogren's as well. And most people, their Sjogren's would get a bit better on this treatment.
Okay.
Because it certainly won't make it worse.
Okay.
Okay, I'd have to talk with Dr. Clemens Baker about your Plaquenil and whether we would stop that or continue it with your treatment.
All right. Great. So you're going to be in touch with her. Great.
Yeah, I'll get in touch with her and send her a copy of the information from here.
Okay.
And there's no big urgency to do anything like this week or anything, but I do think that given the hoarseness and given where the tumors are, that we probably have to start looking at treatment sometime in the next month or so.
Okay.
This treatment does cause your immune system to be affected, so your risk of infection is higher than normal.
Okay.
And have you been somebody who's ever had a lot of infections before?
No, not above normal. And certainly we are being very good elderly people in a world of COVID, would continue that whether either of us are sick or not.
No, I think that's a very, very good idea because your risk of having, high risk infection is very high.
Yes.
And we would also suggest you get the flu shot as well.
Yes, planning on that.
Yep. And have you ever had any blood clots in your legs or your lungs?
No.
Okay. And so the one issue with these slow-growing lymphomas is every so often they can become more aggressive and need really urgent treatment, but most people, when they become aggressive, like they're very, very sick, like they feel very, very bad. They lose like 20 or 30 pounds and they're, having sweats and feeling terrible. So it's not something that's very common and it's very, it's not subtle. But certainly down the road, if you develop any symptoms, we would always want to see you, and you can, there's always, you can always get in touch with my office during the day, but we'll also, when you come, give you all the contact numbers for after hours and evenings.
Okay, fine.
Okay.
Okay. So I guess my question is, I was sort of under the impression that this was a cancer that isn't cured, it's just managed.
Mm-hmm. So this is a slow-growing cancer, and in some ways that's good, and in some ways that has some downside too. The good news about it is it's not usually something that takes your life. It's something that you end up living with for many, many years, although saying that any cancer could become, more difficult and worrisome.
Right.
And I explain it to people a little bit like having, diabetes where, if it's under diet control, you just kind of watch it. But if it becomes more of a problem, you have to start medication. And then there's some people where it's really terrible and they need lots of insulin or they end up with a lot of complications.
Okay.
So I think that that the outcome is usually very good. It's going to depend on how you tolerate the treatment and how your cancer responds.
Okay.
Most people, once we give them chemotherapy, their cancer stays away for about 7 to 10 years.
Okay.
And then it often will start acting up again, and then we have to treat it again.
Okay.
But that's an average. Some people, they go 20 years. Some people, it's only 2 or 3 years.
Okay. And side effects of these two chemo drugs?
So these drugs, the rituximab, I'll send you some information. I'll go through all that. But the rituximab can cause an allergic reaction with some people. that's something that we have to give that drug to you very slowly the first time you get it, because some people get hives or shortness of breath or, feeling unwell when they're getting it.
Right.
But after you tolerate the first one, it's usually not a problem.
Okay.
And after the first one, if you tolerate it, we just give it to you as a little injection in your belly as opposed to intravenously.
Okay.
The other medication, most people, again, tolerate it very well. And like any chemotherapy drug, it can cause low blood counts and risk of infection.
Okay.
There's a small number of people that can develop a rash or some breathing issues associated with it, but most people, that isn't the case, and it does not typically cause your hair to fall out.
Okay.
So most people are able to do their normal activities, have a few days where they feel tired, but on average feel, generally quite well when they're on the treatment.
Okay.
And then we would see you every 4 weeks and check your blood counts every time to make sure everything's okay.
All right.
And then you would get your next treatment. So usually I would see you on, for instance, a Friday, and then you would get treatment Monday and Tuesday.
Okay.
So that's a routine. But, like I said, I would like to see the PET scan first, just to make sure that there's no surprises. And I'd also like to look at what that lung nodule and the liver nodule look like, just to make sure we don't need to do any more biopsies.
And you can do that on the PET scan.
On the PET scan will
Okay.
show me, yeah. And then we're going to see you back here after the PET scan, and I will do all that extensive blood work. We check everybody, for instance, for hepatitis and HIV, and we do all these specialized tests to make sure that you'd be able to tolerate the chemotherapy and there's no issues there.
Okay.
And then we would discuss about whether that's something that you want to start with and when we get started. But most of the time, because of the location of where this is, I think that we should probably start treatment sooner rather than later. But I think that, like I said, I don't think it's urgent we start, immediately. But I do think it would be a good idea to get started as long as the PET scan is showing us what we're expecting to see.
Okay. Yes, we have no plans. No family weddings. Only twins is due in Brooklyn, and we aren't planning to go there either.
No, I would not recommend going to the United States at all.
Okay.
Unfortunately. It's just too dangerous right now.
Yes.
So I think that we just should get the PET scan organized. We usually do that in Ottawa, and that usually happens within about 2 weeks.
Okay.
And then we'll have you come back and see me after that.
Thank you very much.
Do you have any other questions, or does that pretty much cover it?
That covers it.
Okay, excellent. So Lou, who I think you spoke to already,
Yes.
she will send you some information sheets on the chemotherapy.
Thank you.
Just so that you can read about them.
Thank you.
Okay, I'll see you in a few weeks.
All right.
And we'll call you about the PET scan.
Okay, thank you, Dr. Bates.
Okay, bye-bye.
Goodbye.
Bye.